There has been a long-standing belief that a separation exists between mental health professionals and addictions professionals. This belief purports that some clinicians deal with mental health issues, while others address substance use concerns, that these two areas of clinical practice are mutually exclusive. It is time for this false dichotomy to end. Regardless of setting, if you are in the mental health field, you will work with addiction. You will see clients who are in active addiction, in long-term recovery, in relationship with someone with addiction, or living in a home with active addiction. So, as clinicians, the question we should be asking is, are we prepared to recognize and respond to addiction effectively? Addiction does not discriminate and can affect individuals across demographic categories and over the course of the lifespan. Whether you work in a community, agency, school, college, or university, hospital, faith-based organization, or private practice, it is imperative that you can assess for and respond effectively to clients who use drugs of abuse and/or engage in addictive behaviors. In this video, we explore some of the contexts where mental health professionals may encounter addiction. Play therapists and those practitioners who work with children and youth likely will encounter clients who live in homes with active addiction. Parental substance use can be traumatic for a child. It could be a condition influencing child removal to out-of-home care. It may be a factor involved in child maltreatment, and it is considered an adverse childhood experience. Additionally, a sibling's substance use can have a major impact on the client and their entire family system. It is imperative that practitioners who work with children are trained in addiction so as to accurately conceptualize their client's experience. Furthermore, there's a robust relationship between early trauma and adult addiction. Thus, as play therapists and clinicians who work with children and youth address trauma among their clients and foster post-traumatic growth, they are doing preventative work against future addictive behaviors. School counselors and practitioners who work in schools are in prime positions to recognize and intervene with student substance use and addictive behaviors early. Many addictive behaviors begin in adolescence, for example, drinking, vaping, cannabis use, disordered gaming, digital media addiction, pornography misuse, or non-prescription stimulant misuse. School counselors must be trained in addiction so they can engage in both prevention efforts. For example, school-wide campaigns, large group guidance, classroom lessons, and effective early intervention strategies with regard to students' addictive behaviors. School practitioners can employ empirically supported interventions like Esperit, or screening, brief intervention, and referral to treatment, and motivational enhancement interventions to connect students who have initiated substance use to effective community resources. Colleges and universities are considered abstinence-hostile environments in light of the social norms promoting experimentation, partying, and substance use. Moreover, the availability and access to drugs of abuse in collegiate settings, for example, number of bars per square mile, contributes to the high prevalence rates of addictive behaviors among this population. Counselors and mental health professionals who work in college settings must be familiar with the intoxication and withdrawal symptoms of various drugs of abuse to distinguish between substance-induced symptomology and symptoms of mental health concerns among their clients. Additionally, college counselors trained in addiction can contribute to the development of effective prevention programming on their campuses and support collegiate recovery programs. Counselors and therapists who work in the community must also be prepared to assess addictive behaviors among all clients. In light of the stigma associated with substance use and behavioral addictions, individuals with these issues may seek clinical services for other seemingly safer presenting concerns, like marital conflict, depression, anxiety, family issues, or occupational struggles. If clinicians fail to recognize addiction, they may not see treatment gains in their work with these clients as they address only the symptoms, rather than the root cause of the distress. Additionally, substance use is greater among those with mental health concerns. This means that clients who come to counseling for mental health-related issues, for example, depression, anxiety, PTSD, and disordered eating, are at higher risk of using substances than those without mental health concerns. Providing integrated treatment where both the mental health concern and addictive behaviors are addressed simultaneously is the gold standard for treating co-occurring disorders. In conclusion, clients in active addiction, in long-term recovery, living with someone with addiction, or in a relationship with someone with addiction, need mental health professionals who are knowledgeable and trained in addictive behaviors. They need advocates who are familiar with the etiology, neuroscience, progression, and effects of addiction. They need practitioners who know about relapse prevention, levels of addiction treatment, effective clinical strategies for addiction, for example, motivational interviewing, ESPER, and craft and peer support groups. Let's make it our personal responsibility to become trained in addiction and stay up to date on new research and practice approaches so we can provide effective, empathetic care to clients with addiction wherever they present for services. We're getting close to the end, so let's look at some key takeaways for this video. All mental health professionals, regardless of setting, need to be prepared to recognize and respond effectively to clients' substance use and addictive behaviors. Play therapists and child counselors likely will encounter clients who live in a home with active addiction and must be prepared to support the child and family system. Given that many addictive behaviors begin in adolescence, school counselors and mental health practitioners in schools are in prime position to intervene early with students who initiate substance use and connect them with helpful community resources. Colleges and university settings are called abstinence-hostile environments, and practitioners on college campuses must be prepared to assess substance use and behavioral addictions with all clients, as well as differentiate between substance-induced symptoms and symptoms of mental health concerns. Given the prevalence of co-occurring disorders, community mental health professionals must be prepared to treat both mental health issues and addiction simultaneously to provide integrated care. I hope you have enjoyed this video. For more clinical insights on a wide range of mental health topics, visit the Mental Health Academy blog on www.mentalhealthacademy.com.au/blog. Thank you for watching.